Hi guys, Dr. Charles Chabert here, urologist and director of the Prostate Clinic. The following video is here to provide information for you if you are awaiting a Rezum or water vapor treatment for the management of BPH, or in fact if you have some interest in this particular procedure. So to recap, BPH is the benign prostatic enlargement. It is one of the most common causes that we see for men who experience urinary symptoms. As a quick aside, as we progress through life, the prostate grows, and it's the growth of the prostate that compresses the outlet pipe of the bladder and causes urinary symptoms. Those symptoms can be broadly broken down into two key categories. They include obstruction, which is when men notice that their flow is slow, it takes them a long time to pee, and it can be a bit broken or intermittent in nature. Then there are the irritative symptoms, which are due to reciprocal thickening that happens in the bladder as it works harder trying to force urine beyond the obstruction. A thickened bladder wall manifests as more frequency, so the need to pee happens at a smaller capacity, and men go more frequently. They might rush to the toilet, or they might get up at night to pee. So water vapor or Rezum is a relatively new, minimally invasive treatment that is performed in the majority of people as a day case. Before we get to surgery, every man has a urinary test to make sure that there is no infection, and then we would proceed on at a specific time to your treatment. The treatment itself is performed either in the main part of theatres at Pindara private hospital, or alternatively in the day surgery. When you arrive at either of those two centres, you'll go through the administration process, and then you'll be taken through to a holding bay, prior to which we would then make arrangements for your treatment. The treatment itself is done under a general anaesthetic, so you are asleep during the whole treatment. If you are planning to head home that day, it's important to note that you cannot drive for 24 hours after the treatment in light of the anaesthetic, so someone would need to collect you from hospital to take you home and supervise you really for the subsequent 24 hours. The treatment itself is performed through a fine telescopic camera. It's passed through the urethral or the outlet pipe of the bladder, and a very fine needle is passed through the telescopic camera and is used then to deliver steam into the prostate. Now what happens is that steam disperses through the connective tissue, if you like, inside the prostate, so that there is an even distribution of heat or energy to the treated area. On average, I use a total of 6 injections, injecting the steam into the various areas within the prostate to ensure that we've got good coverage and good treatment of the entire transition zone to ensure that we get a good, durable outcome. Each injection is around 1 cubic centimetre of steam, which, as you can imagine, increases the volume of the prostate and potentially causes obstruction. The video that you're currently watching highlights graphically on the left-hand side the process of inserting the needle through into the prostate in a transurethral fashion. On the other side of the image, you can see the real-time intraoperative images and how the steam therapy, the water vapor therapy, is deployed in real life. So as you can imagine, we deliver that volume of fluid to the prostate. It therefore swells. Afterwards, men then struggle. They struggle more to pee than they were beforehand, and as a result we need to put a catheter in. It's usually a very fine catheter that we put in, and that really ensures that the bladder drains adequately after the procedure. You are then given a leg bag, which is a bag that attaches onto the end of the catheter, and that attaches onto your thigh. So urine that fills in the bladder drains through the catheter and collects on the thigh. You are given some education about how to manage that leg bag, and also a night bag, which is a larger bag that plugs into the leg bag, and you're given instructions and education on how to manage that. For most people, they go home with the leg bag and this night bag, and you would keep your catheter for around 3 or 4 days. You then come back to hospital, and we send off a urine test at that time. We remove the catheter, and we perform what's called a trial avoid, where we ensure that you're emptying your bladder okay. We get you to pee in a jug and we measure the volume of fluid that you pee, and we do a small bedside ultrasound to make sure that you're not retaining too much urine. As long as you pass our checks at that point, you may go home. Expect to stay with us for the better part, certainly of the morning. Sometimes it can be 2/3 or 3/4 of a day that men are with us while we wait for the bladder to begin to work properly and to empty. Sometimes that can be a slow process. As I will have explained previously in our pre-op consult, with Rezum treatment, men will notice no improvement in the way that they pee to begin with. And in fact, for the first 2 or 3 weeks after the treatment, there can be some irritation related to the treatment that makes you feel like you need to pee more urgently and more frequently, even get up through the night and pee a little bit more frequently than you were beforehand. What we tend to see, though, is by the 3-week mark, men notice for the first time an improvement in the pressure with which they pee. And it's important to note that from around the 3-week mark through to the 3-month mark, there is a gradual, steady improvement in an individual's urinary symptoms. Certainly in my practice here at the prostate clinic, every man has a specific questionnaire. It's called an International Prostate Symptom Score, but that questionnaire, it's a score out of 35. We do it before treatment, we do it after treatment, and the expectation, if you have Rezum, is that we will see around a 50% improvement in that score. That's the average improvement that we see. So we do not turn, for example, 70-year-old men into 20-year-old men, but we can get a 50% improvement in the way that we pee, or in the way that they pee, I should say. So a gradual, slow, steady improvement that begins with improvement in flow, and then bladder-related symptoms slowly follow suit. It's common to see small amounts of blood within the urine. It can sting and burn to begin with. One of the aims of Rezum over other treatments, other BPH treatments, is that the risk of sexual dysfunction is at the lower end of the spectrum. Sexual dysfunction is 2 things. It's erectile dysfunction and it's ejaculatory function. And with Rezum, there's next to 0 risk of erectile dysfunction, and I tell men that there is around a 5% risk that they may notice a reduction in the volume of their ejaculate fluid, and in some circumstances they may ejaculate no fluid at all. But the majority of men following this procedure do retain normal ejaculatory function. Sometimes we can see that men develop infections, and this can be related to the catheterization process. So if you are in that post-operative period where the catheter is being removed and you notice either a change in the smell of your urine, more blood in your urine, or pain, or stinging or burning when you pee, please get in touch with the prostate clinic. We would make arrangements for a urine test, and if appropriate, we would commence you on antibiotics. I see every man following this procedure at the 3-month mark. We fill out the questionnaires again, we get you to do another flow test, and we confirm that there's been a big improvement in the way that you pee, and also answer any residual questions that you may have at that time. Moving forward, the plan is usually to continue on with an annual PSA test, which can be done either locally here at the prostate clinic or alternatively through your local GP. I hope this answers some of your questions. If you do have additional questions or comments, please leave them in the comment box below. Or if you're awaiting this procedure with me through the prostate clinic, please, and you'd like a sooner answer, contact my office and I will respond to you accordingly. Thanks again.